Okay, so picture this. You wake up and your throat is so scratchy, it feels like you swallowed a cheese grater.
Ouch.
Right. We've all been there.
Yeah.
But what happens when that scratchy feeling sticks around and you hear the words cobblestone throat?
Cobblestone Throat.
That's what we're diving into today.
I like it.
All the mysteries of this strangely named condition.
Yeah.
We'll be dissecting some recent medical articles about this, and trust me, you'll never look at a sore throat the same way again.
I'm ready.
All right, so joining me in this exploration is our expert ready to shed light on all things cobblestone throat. Let's unpack this.
And to start unpacking, it's helpful to know that cobblestone throat is really just a more visual term for something that you're probably pretty familiar with. Pharyngitis.
Pharyngitis. Okay, right. That
Yeah.
explains the medical textbook vibe. But cobblestone, that's a new one for me. Paint us a picture. What are we even talking about here?
So imagine you're looking at the back of your throat, right?
Okay.
And instead of a smooth pink surface, what you see is small rounded bumps,
Uh-oh.
almost like tiny cobblestones,
Right.
paving the back of your throat.
Okay.
So that's the inflammation giving it that bumpy texture.
I don't know if I'd call that a pretty picture, but it definitely paints a vivid image.
Right.
And is all pharyngitis created equal?
That's a great question. And
Yeah.
not exactly.
Eh.
It's really important to differentiate between acute and chronic pharyngitis.
Okay.
So acute pharyngitis is your typical sore throat. It's usually caused by a virus and it clears up within a few days. But chronic pharyngitis, that's a different story altogether.
Okay.
That means the inflammation lingers for weeks or even months.
Yeah. So that nagging sore throat that just won't quit even after you've gone through a whole box of cough drops.
Exactly.
What causes that staying power?
Well, you see, acute pharyngitis is usually short-lived,
Mm.
right? But chronic pharyngitis, that's way more complex. It often points to some kind of persistent irritation or an underlying issue that needs to be addressed.
So it's not just catching a cold from your coworker.
Right.
So what are we talking about here? What are some of the usual suspects behind this cobblestone throat mystery?
Well, let's start with the usual suspects, right?
Right.
The common cold, the flu, those are often the culprits behind acute pharyngitis.
Right. Those we know and love.
Yeah,
Or tolerate, I guess.
tolerate, yes.
But you mentioned chronic pharyngitis being a different story.
Total.
What else could be going on there?
That's where we start to see a wider range of possibilities.
Mm-hmm.
So it could be bacterial infections, fungal infections, or even things like allergies, dry air, or even acid reflux.
Okay, hold on a second. Acid reflux can cause cobblestone throat.
It can.
That's not something you hear every day. How does that even work?
Yeah, so it's all about location.
Okay.
You see that like burning sensation that you feel with heartburn?
Yeah.
That's stomach acid that's creeping up into your esophagus.
All right.
And unfortunately, that acid doesn't always know when to stop.
Oh, no.
Sometimes it reaches the back of the throat, irritating that delicate lining and causing inflammation.
So it's like a rogue splash damage attack on your throat.
That's a great way to put it.
Yeet.
And just like if you repeatedly splashed your skin with lemon juice, it would get irritated, right?
Yeah.
That chronic exposure to stomach acid can lead to persistent inflammation in the throat, hence the cobblestone appearance.
Makes a lot of sense. And I'm guessing those other culprits you mentioned, like allergies and dry air, work in a similar way. Just constantly irritating the throat over time.
You got it. Think of it like a repetitive stress injury,
Okay.
but for your throat.
Oh, fun.
So allergies introduce irritants like pollen and dust, while dry air saps moisture from those delicate mucous membranes that line your throat, making them way more vulnerable to damage and inflammation.
So it's not just about what we're putting into our throats, but what's in the air around us. It's like our poor throats can't catch a break.
And unfortunately, that's often the case with chronic pharyngitis. And we haven't even touched on smoking yet, which is another major culprit.
Right. Smoking, I can only imagine that inhaling hot smoke on a regular basis wouldn't be doing any favors for my throat.
Yeah, definitely not. Cigarette smoke contains a whole cocktail of harmful chemicals that directly irritate the lining of the throat, causing inflammation and damage.
Yeah.
And just like with our other culprits, that chronic exposure can lead to those more long-lasting problems like cobblestone throat.
So, smoking. Bad for your lungs, bad for your heart, and bad for your...
Yeah, it all adds up, unfortunately. And to make matters even more complex, sometimes pinpointing the exact cause of chronic pharyngitis can be like solving a medical mystery.
A medical mystery, you say?
Yeah.
Now, this is where it gets really interesting. We've talked about all these common culprits, but what about those cases where it's not so clear-cut?
Right.
What are some of the more unusual suspects that doctors look for in those situations?
Yeah, that's where the detective work really begins. In some cases, chronic pharyngitis might be a side effect of certain medications, a symptom of another underlying health condition, or even,
Don't leave me hanging. What other suspects are on the lineup when it comes to this chronic cobblestone throat?
well, believe it or not, sometimes food sensitivities can be the culprit.
Food sensitivities. You mean like a food allergy? But wouldn't someone know if they had a food allergy?
Not necessarily.
Huh.
You see, we often think of allergies as these immediate dramatic reactions,
Right.
but food sensitivities can be way more subtle.
Okay.
They can cause low-grade inflammation over time, and the throat seems particularly vulnerable for some people.
So you're saying my morning coffee can be the reason that I'm battling this cobblestone throat. I'm a little
Mm.
terrified to give up my coffee.
Well, hold on. It doesn't necessarily mean that you need to give up your coffee forever, but it does highlight why it's so important to work with a doctor to get to the root of the problem, especially with chronic pharyngitis.
Okay, that makes sense. So let's say we've identified the culprit behind the cobblestone throat, whether it's a common cold or a surprising food sensitivity. What happens next? How do we actually get rid of this thing?
Just like a good detective tailors their approach to the case treatment for cobblestone throat, really depends on the underlying cause.
So no one-size-fits-all solution.
Afraid not. If it's a viral infection like the common cold, it's often a matter of rest fluids and maybe some over-the-counter remedies to manage the symptoms while your body fights it off.
The classic waited-out approach.
Ex-
Sometimes the hardest thing to do, but oftentimes the most effective. What about bacterial infections, though? That's where antibiotics come in, right?
Exactly. If a bacterial infection like strep throat is what's causing your cobblestone throat,
Mm.
your doctor will likely prescribe antibiotics to knock it out. But it's crucial to remember that antibiotics only target bacteria. They're ineffective against viral infections.
So no popping antibiotics at the first sign of a sniffle.
Precisely. Taking antibiotics when you don't need them can actually disrupt your body's natural balance and contribute to antibiotic resistance, which is a growing public health concern. Always best to consult a healthcare professional to get the proper diagnosis and treatment plan.
Solid advice. Now, for those dealing with the more persistent culprit of chronic cobblestone throat, what are some of the strategies for finding relief?
Yeah, that's where those lifestyle modifications that we talked about earlier really come into play. If smoking is the culprit, well, quitting is by far the most effective step toward a healthier throat, and honestly, a healthier you overall.
And I imagine that's easier said than done for a lot of people.
Absolutely. But quitting smoking is a journey, not a destination. And there are tons of great resources and support systems available. So the potential benefits, including a healthier throat, definitely make it a journey worth taking.
Well said. What about those other culprits like allergies? Any advice for minimizing those triggers?
For sure. If allergies are playing a role, identifying and minimizing your exposure to those triggers is key. This might involve using air purifiers, getting special bedding to reduce dust mites, or even working with an allergist to explore medication options. It's all about finding what works best for you.
So it's a personalized approach, just like with treatment. That makes a lot of sense. We've covered a lot of ground today, from that strange name to the surprising culprits behind cobblestone throat. Any final thoughts for our listeners before we wrap up this deep dive?
Yeah, I think the most important takeaway here is that knowledge is power. Understanding the causes, the symptoms, and the treatment options for cobblestone throat really empowers you to make informed decisions about your health. And if you're experiencing a persistent sore throat, definitely don't hesitate to consult a healthcare professional. They can help you get to the bottom of it and get you on the road to recovery.
Absolutely. We've gone from what on earth is cobblestone throat to really understanding its causes, symptoms, and even how to find relief. And, sometimes knowing what to look for is half the battle. Thanks for guiding us through this fascinating and surprisingly complex condition.
Happy to do it. Always a pleasure to shed some light on the mysteries of the throat.
And to our listeners, thanks for joining us on this deep dive into the world of cobblestone throat. Remember, knowledge is power, and sometimes the answers are closer than you think. Until next time, stay curious and take care of those throats.